Hey y'all, happy Monday. Unfortunately, I do have to deliver some bad news about what's going on with healthcare in Alabama. So another rural hospital in Alabama has shut its doors. Unfortunately, this is an ongoing issue because Alabama refuses to expand Medicaid. So the latest hospital to close was the Clark County Thomasville Regional Medical Center, and there have been 4 labor and delivery units that have closed since last October. So here are some stats for you. More than 1 in 4 women in Alabama live more than 30 minutes away from a hospital that has a labor and delivery unit. 24 hospitals in Alabama are at risk for immediate closure, and 65% of Alabama hospitals have lost services since 2015. We have time right now to start putting the pressure on our lawmakers to ensure that they understand how important it is to expand Medicaid. Not only are hospitals important for access to healthcare in our rural areas, they're also employers. There is an economic impact outside of just healthcare. These hospitals provide community and support to hundreds of thousands of Alabamians. We need to close the coverage gap. Like I said, we have time. We have time to start placing the pressure on our lawmakers, and you can do that by going right up there.
Alabamians are faced with a massive Medicare situation going on right now. If you haven't heard, there are many plans throughout the state of Alabama that are pulling out of the market. These are Medicare Advantage plans and these are PPO plans. If you're on one of these, you should have gotten a notice saying that your plan is exiting and that you need to find a new plan. You have 2 options here. Number 1, you can find a new Medicare Advantage plan. Maybe you love it, that's all you can afford, that's what you want to go with. Number 2, this is your golden goose opportunity to get a Medicare supplement guaranteed issue, okay? What that means is that you can pick a plan that is guaranteed issue and they can look and they can accept you despite your history. So if you're on a bunch of prescriptions, if you have had medical history that's pretty serious, you can still get a Medicare supplement. But again, what this means is if you're on a Medicare Advantage plan and you do not make a decision, you will wind up with back to original Medicare and no drug coverage come January 1 if you do not make a decision. Now there's plenty of plans that are being what's called crosswalked. Maybe that plan's exiting and they're rolling you over into a new plan. So that could be another situation where you're just transitioning to a different plan, similar name, similar product. But what we're talking about is plan exits. Your plan, you should have gotten something in mail. So if you're in Alabama and you're not sure if your plan's exiting, or maybe you got that letter and you still have not made a decision, folks, we're just a few weeks away from the end of Medicare annual enrollment period. Time is of the essence. You need to make a decision, make an appointment, get it figured out. If you need help, if you're in Alabama or know someone in Alabama, please share this. We surprisingly talk to a lot of people every day who are in the situation that they didn't even realize. They don't check the mail. They get too much mail and they're overwhelmed with it. So if you're one of those people, or if you know someone who's on a Medicare Advantage plan in Alabama and other places across the country, you need to hook them up with us ASAP. So please share this, please save this, and get this to your folks in Alabama who need help. We can do it. We're here. We're local. We can work with you. But I need your help to save this video, to share it, pump it through the algorithm, and make sure our seniors are getting the care and the help that they need, and they're not winding up without health coverage when it comes to January 1.
I just got some very troubling news that I wanted to share with you. We were just informed that the Alabama Public Health Department was informed that a $190 million CDC grant was terminated without any warning. Related to that grant was 140 full-time employees for county health departments all throughout the state of Alabama. That funding was to help prevent infectious diseases. They just found out about it on Tuesday, and the cuts were immediately effective that Monday. And that means that we will lose personnel in county health departments all across the state of Alabama. I know that the state public health department is scrounging to find alternative funding, and I really hope that our senators are listening and are going to do something to push back against these horrible cuts, because what this means is that investigations of outbreaks in prisons, in nursing homes, in daycare centers are going to go without personnel to actually do those investigations. There's currently an outbreak in the states of measles. It hasn't come to the state of Alabama yet, but the lack of employment of workforce in the public health, county health departments means that so many communicable diseases may go undetected. It will affect the most vulnerable in our communities. This is the latest cut by the Trump administration, the Doge, and Elon Musk. And I hope you know that I will continue to fight, to legislate, to litigate, and to help mobilize my constituents so that their voices are amplified. We got to make sure that we push back against these unacceptable.
Reason 472 why I stopped believing in the healthcare system across the board here in America. A couple months ago, I went to the dentist and they were like, oh, you have 2 cavities. We need to get them filled. I'm like, that's weird. Like, I was just here 4 months ago. I came in early because my kids were scheduled. Like, I didn't have anything then. Like, how is that possible? They're like, oh, we're not sure. And keep in mind, this dentist is new. Like, that was the second time I'd been there because we had just moved. So it was right by the house. I'm like, okay. Well, I didn't have time that day to get them filled. So I was like, let me make an appointment. I'll come back. Then they call me. They're like, we don't take your insurance anymore. I'm like, that's fine. I was going to go to my other dentist anyways because since about 2022, I have always got a second opinion for anything medical. If it's going to alter my body, I'm like, let me get a second opinion because I have lost all faith and trust in doctors everywhere. So fast forward to today, I go to the dentist we had been seeing for 3 or 4 years by our old house. They took x-rays and they look at me and they're like, are you sure? I'm like, that's what they said. And then they took pictures with their camera like inside and they're like, where? I'm like, they said the bottom, I don't know. Then the dentist comes in, he pokes around, he scrapes around all the things. He goes, I don't see any cavities. Sick. So that other dentist was going to drill into 2 of my teeth, fill them, and charge me for it. And this has happened before, like my younger son, and aside from this dentist, which I really, really like, and we started going to because a pediatric dentist that I was taking my kids to, every time we went, they were like, your son has another cavity. He has another cavity. I'm like, how in the hell? He has no more teeth left. Like, he doesn't have there's no more teeth to fill. Like, what are you talking about? And so I came here and they told you he had 5, which they did. They were like, he has 5 cavities. We need to put him out. We need to fill them all. And we came here and they were like, he has 1. So this is just your reminder to get a second opinion. If it's going to alter your body in any way by the form of a doctor, get a second opinion before you make a decision. That's all. Okay? And look at my pearly whites.
Well, I guess none of us are ever going to be able to afford healthcare again, huh? In 2010, Barack Obama and the Democrats, only the Democrats, exploded the healthcare system. They took everything that was in place and they ripped it out and replaced it with Obamacare. They named it the Affordable Care Act because that makes it affordable, right? They said you could keep your doctor if you like him, you can keep your plan if you like him. They said essentially your premiums will go down to the price of your cable bill. These are actual quotes. This passes and then anybody in the lower to medium income range can no longer afford their insurance plan without subsidies. So the American taxpayer is forced to subsidize health care. Now the subsidies go to the insurance company, not the insured. The insurance companies are now just getting taxpayer money, so they up their rates as much as they want. Eventually, nobody can afford insurance, so Joe Biden in 2020 creates the American Rescue Plan, which allows for anybody of any income level to take subsidies to pay for healthcare. They set an end date for 2023 for the subsidies. Now 2023 rolls around and they realize, oh my gosh, no one's going to be able to afford insurance, so they push it. They extend the end date to 2025, which is where we're at now. So the problem they created in 2010 is finally coming back to bite them, and what do? They shut the government down, run to the news, and go, it's the Republicans' fault. Obamacare was always destined to fail. The people who created it knew that. They wanted to make Americans dependent on the system and use them as political leverage and pawns. How do we not?
This is the one video to rule them all. If TikTok dies and you are not able to follow me on other platforms, you can save this video because it is going to be a speed round of my most used patient resources. And no, this is not sponsored. Let's go. All of these services are free except for one, and I'll tell you which one that is. Number 1, Patient Advocate Foundation Case Management Service. This is for anybody with a chronic or serious illness who needs individualized help help evaluating their financial or treatment options. The patient helpline is a hotline that any patient can reach out to with pretty much any healthcare issue. Their team will point you in the direction of local and national resources that will hopefully help fix the issue. Triage Health is for people with serious medical conditions who need to know their legal rights as a patient. That is everything from how much your employer has to accommodate your medical condition to what your rights are with insurance denials. These lawyers will not represent you in a lawsuit. They do education only. Next, the National Association of The National Association of Medication Access and Patient Advocates. This is help for anybody who is struggling to find or pay for their medications. Next is $4. This is for anybody with a hospital bill who needs help applying for hospital bill discount programs. Fund Finder. This shows you the charitable funds available for different diagnoses. So whether you have cancer, diabetes, long COVID, whatever, you can look up your diagnosis and see if there are any funds available to help you with the treatment costs. Last is Greater National Advocates. This is the only paid service on my list. This is for when you need to hire a specialized patient advocate to help you navigate a unique, complex healthcare issue. These are patient advocates that are specialized in everything from negotiating medical bills to navigating long-term care and nursing home placement and everything else. I do want to note that some of these advocates have sliding scale and pro bono services, but that's up to each advocate. Those are my most frequently used resources. You can pause and screenshot what you need. However, if what you need is not on that list, I have more resources on my page. And if TikTok is truly going to be banned forever, please know that 4 years ago, I was a nurse working in a hospital screaming into the void about our broken healthcare system. But today, I am a nurse who is still screaming, but now I get to scream in rooms full of people who can actually do something about it. You all were instrumental in making that happen. So even if you don't see my face anymore on this app, I am carrying you all with me in my work, and I will make sure that the voice of the patient and the voice of the healthcare worker will